We have already discussed about the classification of NSAID. So there were about different classes. About 24 drugs are classified under the NSAID classification, depending whether it is a non-selective type, selective type, preferential type, or the analgesia antipyretic with poor anti-inflammatory property. Out of these 24, we need to remember at least 15, right? So in this table, very high, extremely high, okay, you need to remember this table very well. In this NSAID comparison table, we'll compare all those important 15 type of NSAID in 5 different category. Its anti-platelet effect, analgesic effect, antipyretic effect, anti-inflammatory property, and the risk to cause the gastric bleeding, right? I will denote the potency and power with the help of upward arrow, mild, moderate, high, and very high, right? So let's start. Aspirin is very potent, okay? It is high anti-platelet effect and effect on platelet irreversibly. So in order to function the platelet again, it has to reform, right? Next is ibuprofen. Ibuprofen is less powerful for the antiplatelet effect in comparison to the aspirin, right? It's only one upward arrow and it is reversible. Similar property for the naproxen, one, and it is also reversible. The rest of the other families, other NSAID, they have about limited or about like minimal effect, right? I will denote minimal effect as I. Okay, minimal effect, right? All of the category, all of the NSAIDs have this minimal effect, right? Nimesulide also, diclofenac also, aceclofenac also, celecoxib, etocoxib, paracetamol, nifopam, and mefenamic acid has little bit. Okay, but don't need to remember this minimal effect, okay? Just remember this aspirin for the anti-platelet effect. Moreover, if you want to remember more, have a knowledge of ibuprofen and naproxen, but focus more on the aspirin. Know that the aspirin has irreversible high potency, high power for the anti-platelet effect, right? So whenever we need the action in any kind of disorder, diseases, conditions, situations, or whatever, when we want the patient to have the anti-platelet effect in order to stop or decrease the chance of having some thrombus formation, at that time we increase the dosage of aspirin. Aspirin is again in different types. We have in the pharmacy aspirin, dispirin, ecospirin, and whatever. We will discuss all of these NSAIDs in like one particular NSAID in much more detail. You will have a much more clearer view like that. But right now, let's categorize them on this basis only. The next slide will focus more on side effects, and then we'll choose one particular NSAID, and we will discuss more on that. Okay, it will be hardly like 2 or 3 minute video per NSAID. It will be much more useful, right? So right, analgesic property. For the analgesic property, aspirin has moderate analgesic property. It has a very high antipyretic, not very high, it has a moderate, right? For the anti-inflammatory, it has a high anti-inflammatory effect, and it is very high. 1, 2, 3, 4. Very high risk for causing the gastric bleeding. Next is ibuprofen. Ibuprofen has much better power for analgesia. Okay, so 3 is sufficient, right? This ibuprofen is really very nice drug actually, because it also affect on antipyretic property, right? It has a high antipyretic property, it has a high anti-inflammatory property, and it has moderate risk for bleeding as compared to aspirin. Next is naproxen, ibuprofen, naproxen, so similar. but a little bit more potent, right? But it is still similar. So naproxen over here, it has a less antipyretic property though. For the anti-inflammatory, it ranges from about 2 to 3, but still sometimes there are still differences, like why naproxen is still like much more powerful, because there are some other categorization that we can do, right, on the basis of duration of action. So there are many other field, okay, on which we can categorize all these NSAIDs. We will discuss all these NSAIDs later, don't worry about that. Focus on major these 5 things. Right, so we were on the gastric bleeding. For naproxen, it has a higher risk to cause gastric bleeding as compared to the ibuprofen. Next is ketorolac. Ketorolac is very high analgesic. Okay, among like whole NSAID family, ketorolac probably the best. I'm talking about the NSAID, right? Remember we have discussed about this analgesic ladder. We are over here right now, okay? So whenever the patient comes, ask the patient to pain scale, right? To mark from 0 to 10. 10 is like the excruciating pain the person can have, which can cause even fainting of the patient. The patient may even faint, right? So depending upon how severe the condition is, we can choose, okay, which type of which kind of NSAID we can choose, right? However, we also choose for the other property as well. For example, the patient have already like GERD, okay, the patient is already having ulcers in the patient. We will not choose the NSAID which will have a higher risk for causing the gastric bleeding. We'll have some other options, right? So these are the stuffs we usually go through before choosing a particular type of NSAID, if you want to be a good doctor. However, if not, if you just want to decrease the pain, you can give any type of painkiller, okay. You can even give the ketorolac. However, for the ketorolac, the risk is very high to cause the gastric bleeding. Yes, you will cure the patient's pain, but if you will give continuous, okay, gastric bleeding also has some criteria. We will discuss that criteria later, but right now just compare, okay. Let's finish this table first. For the ketorolac, it has a mild antipyretic property, it has a mild anti-inflammatory property. Next is indomethacin. It has a high, okay, let's mark this like this. All these high properties, very high. Let's mark it like this. This is important to keep in mind. Right. So we were doing the indomethacin. For the indomethacin, the antipyretic effect is moderate. And then we have the anti-inflammatory property. Anti-inflammatory property for the indomethacin is about high, and the indomethacin has a high power to cause the gastric bleeding. Okay, next is propionazole. Propionazole has moderate analgesic property, it has high antipyretic property, it has mild anti-inflammatory property, but rather than all this thing, the risk is still high for propionazole. Next is nimesulide. However, it is not used in Indian market anymore. Okay, it is decreased the usage, but still you can find nimesulide with combination of paracetamol, usually given in cough and cold type of scenarios, right? So nimesulide, it has a it has a high analgesic property, it has a high antipyretic property, it has moderate anti-inflammatory property, and it has a moderate level of gastric bleeding, right? So if it has a like moderate gastric bleeding, why it is like removed from the market? It has some other side effects which are much more disastrous. We will talk about that when we talk about nimesulide in much more detail. Now the diclofenac. Diclofenac has very nice analgesic property, right? However, it does not cover fever that well, so mild to about moderate fever coverage. Then it has a high anti-inflammatory property. So whenever there is like some sort of accident, right, there is breakage of bone tissues, so you can give this thing. And regarding the gastric bleeding, it has a high risk, right? Now there's aceclofenac, similar to diclofenac, the same properties. Over here has a high analgesic properties. It has mild to moderate antipyretic property, and then it has a high anti-inflammatory property. This was the antipyretic, sorry. And lastly, it has moderate risk. What happened to my stylus? It has a moderate risk. Just give me a moment. Let me charge my stylus. Right. So this was a table. We are almost about to finish this table. So for the aceclofenac, we have less risk than diclofenac in causing the gastric bleeding. Right. For the celecoxib, let's finish it off faster. It has mild for the toricoxib also, same drug. It has same properties as well. It has mild antipyretic effect, both of them has high anti-inflammatory property, and among the whole NSAID group, these two has least GI risk for bleeding. Right. Next is paracetamol, most commonly drug which is given when the patient have pain, when the patient is not feeling well, and also one of the most safest drug actually. So it has a very high analgesic, it has a high antipyretic action. However, it has a very mild, to about none anti-inflammatories. Little bit it can affect, but it does not help so much in inflammation, right? And it does not cause as gastric ulcer. For the nifopam has a high analgesic property, and the rest of the properties not present. Good also, bad also. Second lastly, the mefenamic acid, very nice drug used by our females, right, during their menstrual cramps. This mefenamic acid or mefenate is actually combined with other drugs and commonly known as meftol spas. It helps in all those conditions, right? Now, depending upon the duration of action, half-life, and other things, we prescribe such drugs, right? So mefenamic acid has high analgesic property. It has a high antipyretic property, mild to moderate about anti-inflammatory property, and high risk for gastric bleeding. Piroxicam has high analgesic property. It has mild antipyretic property, and it has a very high anti-inflammatory property, right? If there's inflammation, you can choose this. However, we have to pay the price because it is also among one of those drugs which has a very high risk to cause GI bleed, right? So all these 4 upward marks we have already covered. So yeah, this was important table. And remember one thing, whenever there's moderate to high risk of GI bleed, we add PPIs with it. So most commonly we know that most of the time whenever a doctor prescribes some sort of anti-inflammatories, some sort of NSAID which have a high risk to cause the gastric bleeding, it will give you a drug, and they say that it decreases gas from your body, but actually it decreases the acid, because more the acid, more trouble you will have. So it decreases acid production. Omeprazole, right? Raprazole, pantoprazole, etc. Pantoprazole. So PPIs will have a suffix of prazole. We will discuss about all these type of PPIs, in which condition you will have to give which type of PPI, right? You should remember at least, okay, all these things. It will be helpful. However, if not, you can still give any type of NSAID. It will be beneficial to the patient. However, it is very important to know the condition of the patient before prescribing any type of specific NSAID, because for the comorbidities you can even deteriorate the patient. So if the patient is stable, right, if the patient has pain, okay, you can choose, right, from analgesia. You can use, most commonly used, I'll tell you, it is ibuprofen, right? You can still jump to naproxen, but it has a higher risk to cause the gastric bleeding. Always remember these three, okay, these three, and later on you can focus on these three ones, okay, these three. Rest of the drugs you can use, not so much thinking. You don't need to put your brain so much if the patient is stable, okay, if the patient's condition is normal and there's nothing much to worry about. If the patient just have fever, pain, use ibuprofen. You can use, okay, you can use aceclofenac also. You can also use paracetamol, the most favorite among all, right? If the patient pain is even more, then you have to take the risk to cause gastric bleeding. However, if you're causing a risk of gastric bleeding, try to give the PPIs along with it, right? So that's why if you're taking aspirin, Disprin, because most commonly when the patient have a headache, they take Disprin, right? Remember, it can cause gastric bleeding. However, the gastric bleeding has one specific thing. Gastric bleeding, like all of the NSAID have this one thing in common, that if you take that particular NSAID for high dosage and for greater period of time, then only it will cause the gastric bleeding. Just like one single dose, choose any of them, okay? This is just for the gastric bleeding, right? Then again, some of the other drug have some effect on cardiovascular condition and so and so. Still you can think, okay, before giving the particular NSAID, right? In the second lecture, we will talk about the side effect. After that, you will have a much more clearer picture in what sort of situation and scenarios which NSAID to choose, right? So this was NSAID comparison table. Pause the video, take a screenshot, picture, whatever, and try to remember, okay? Stick it on a wall. Have a look on a daily basis and focus, right? So this is how now you remember why the paracetamol is used so much. It has a nice coverage for analgesic property. It has a very nice antipyretic property. Then also sometimes we used to combine paracetamol and the ibuprofen, right? We also combine some other drugs. Why we combine, right? We will talk about all of these questions in other lecture. So this was the NSAID comparison table for you. Thank you for watching.